Welcome to this MLN Connects video on updates to the Hospice Item Set Manual version 1.02. There are 4 modules to this presentation. Module 3 covers updates to Chapter 2, Administrative Sections of the HIS Manual version 1.02. This presentation was recorded at the MLN Connects National Provider Call on June 17, 2015.
In this section of the presentation, we will begin to review Chapter 2 of the HIS Manual, which contains general conventions for completing the HIS items, as well as detailed item-specific guidance. To complete each HIS item accurately and fully, hospice staff should understand what information and data each HIS item requires and complete the item based only on what is being requested. Responses to items on the HIS can be selected by the assessing clinician as part of the patient visit and assessment, or could be based on information documented in the clinical record and abstracted on or prior to the completion date reported in item Z0500B. In general, sources external to the clinical record should not be used as documentation to complete HIS items. However, there are some instances where the HIS data collector may consult sources other than the hospice clinical record to complete HIS items. For example, completion of Section A administrative information items may require review of claims or billing records. Section F preferences items may require review of physician order for life-sustaining treatment or POST forms or other equivalent forms. If the person completing the HIS does not find a care process documented in the hospice clinical record, the care process is considered not to have occurred. In these instances, complete the HIS items accordingly, following skip patterns outlined in the HIS. On the next slide, we will begin discussing in more detail the individual HIS items and how they should be collected. Remember that there are 6 sections in the hospice item set, 3 administrative sections, sections A, I, and Z, that are primarily used for record matching and identification, and 3 care process sections, sections F, J, and N, which serve as the main data source for the quality measure calculations. We'll start by looking at the HIS items in Section A, Administrative Information. Section A starts on page 2A-1 of the manual and contains 15 HIS items that serve to uniquely identify each patient, the hospice from which he or she receives services, and the reason for the record. Since the focus of this training is to highlight new and refined guidance associated with the release of version 1.02 of the HIS manual, we will not be discussing every HIS item. Instead, we will focus on those items with new or updated guidance in version 1.02 of the HIS manual. Section A items with new or updated guidance are listed in bold font on this slide. Remember that the manual page numbers that correspond to the item or items we are discussing are in the bottom right corner of each slide. This may be particularly helpful for Section A, as we will be highlighting 6 of the 15 Section A items, and therefore will not be proceeding sequentially through the items. Instructions for completing item A0205 begin on page 2A-2 of the HIS manual. Item A0205 reports the patient's site of service at admission. When completing this item, read through the response options and definitions carefully to ensure you can differentiate the various sites of service. We received many questions on the Quality Help Desk about the difference between response option 03 and 04 for this item, which are hospice provided and nursing long-term care or non-skilled nursing facility, and hospice provided in a skilled nursing facility. We will discuss the difference between these two response options in an upcoming slide, since the distinction applies to both item A0205 and item A1802. On the next slide, we'll look at item A1802, which is on page 2A-11 of the HIS manual and reports where the patient was prior to the hospice admission. The response options for A1802 are very similar, but are not the same as the response options for item A0205. If the patient was in multiple settings prior to the admission to hospice, choose the response option that reflects where the patient was at the time of referral to hospice. For example, suppose there was a patient who was both in the hospital and at home in the week prior to admission to hospice. In this situation, the patient was in the hospital when they were referred to hospice and were then discharged to the home 2 days prior to the start of hospice services. In this example, select response 5, short stay acute hospital, since the patient was in the hospital at the time of referral. As mentioned previously, for items A0205 and A1802, a common question received on the help desk is how are skilled nursing facilities, or SNFs, different from nursing facilities, also known as NIFs, or long-term care facilities. For the purposes of completing items A0205 and A1802, SNF is not synonymous with NIF. To use the response option for SNF, the patient must be in a SNF or in the SNF portion of a dually certified nursing facility. Otherwise, choose the response option for NIF, or long-term care facility. On the next slide, we'll discuss item A0245, which is on page 2A-4 of the HIS manual. This item is intended to reflect the date on which the initial nursing assessment, as defined in the Medicare Hospice Conditions of Participation, was initiated. If a patient is admitted to the hospice and an initial assessment is initiated, but the patient is discharged before it is completed, A0245 should report the date on which the initial assessment was initiated. You should report the date the initial assessment was initiated, even if the entire assessment was not completed or was initiated in a site of service other than the site of service the patient is being discharged from. However, if the patient was admitted to the hospice, but no initial assessment was initiated before the patient was discharged, new guidance in version 1.02 of the HIS manual instructs providers to enter a dash for item A0245. Remember, HIS reporting is required for all patients meeting the 3 criteria for admission that were presented earlier. This means that if a patient meets the definition of admitted, inability to initiate or complete an admission assessment does not eliminate the need for HIS submission for this patient. If there is a signed election statement, the patient did not expire prior to the effective date of hospice care, and a visit was made in the setting where hospice services will be initiated, the patient is considered admitted and HIS reporting is required. Item A0700 is on page 2A-9 of version 1.02 of the HIS manual. This item reports the patient's Medicaid number. For item A0700, reporting of the patient's Medicaid number is used for patient identification purposes only, not for billing or payment. This means if the patient has a Medicaid number, you should enter it into item A0700, even if Medicaid is not the payer or if Medicaid is a secondary payer. To complete A0700, confirm that the patient's legal name on the HIS record matches the patient's legal name on the Medicaid card. Enter a plus in the leftmost box if the Medicaid number is pending. If the patient is not a Medicaid recipient, enter an N in the leftmost box. New guidance in version 1.02 of the HIS manual states that if a patient refuses to supply his or her Medicaid number, or the Medicaid number is unknown, you should leave A0700 blank. So now the guidance for A0600A, Medicare number, A0600B, Social Security number, and A0700 Medicaid number are aligned and consistent. If the number is unknown or the patient is unwilling to disclose, leave the item blank. The next slide discusses item A1000, which is the race or ethnicity item. This item reports the race or ethnic categories that the patient uses to identify him or herself. This information is important to collect and provides data to assist CMS in achieving equitable care for hospice patients. HIS data collection guidance for item A1000 indicates that the preferred method of identifying race or ethnicity is by patient report. If the patient is unable to communicate this information, a family member or caregiver may provide the information. Lastly, observer identification can be used to complete this item if the patient is unable to respond and no family member, significant other, guardian, or legally authorized representative is available. The question most often received on the Quality Help Desk about this item is what racial or ethnic categories are included in response option F, white. As noted on the slide, response option F, white, includes any person having origins in the original peoples of Europe, the Middle East, or North Africa. This slide shows the OMB guidance for each racial and ethnic category in item A1000. Providers should review the OMB definitions for each response option prior to making a selection for item A1000. OMB definitions for each response option are also included in the HIS manual on pages 2A-10 and 2A-11. The final administrative section that we'll cover is Section Z. There are two items in Section Z, Z0400, signatures of persons completing any area of the record, and Z0500, signature of person verifying record completion. Instructions for completing these items begin on page 2Z-1 of the HIS manual. The signatures in Z0400 and Z0500A are for use and retention by the hospice. They indicate attestation that the abstracted information in the HIS record is complete and accurately reflects patient information. However, these signatures are not transmitted to CMS. The only thing that is transmitted to CMS through the Keys ASAP system in this section is Z0500B, which is the HIS completion date. In practical terms, Section Z items allow hospices to do two things. The signatures in Z0400 allow the hospice to look back and see who is responsible for completing which sections. Item Z0500 allows the hospice to determine who verified that the HIS record was complete and when completion occurred. Let's take a closer look at the two Section Z items. The next slide presents information on Z0400. The intent of this item is to capture signatures, electronic or physical, to reflect the person completing any item in any section of the HIS. In an electronic medical record, this may be accomplished electronically, which is perfectly acceptable. Z0400 signatures and dates are not submitted to CMS as part of the HIS record. Thus, it is at the discretion of the hospice to develop internal policies and procedures for completing and retaining Z0400. The final item is Z0500. The intent of item Z0500A is to reflect the signature of the individual who certifies that the entire HIS record, including all sections, is complete. This person is not certifying to the accuracy of the HIS, just that it is complete. This signature is not submitted to CMS as part of the HIS record. Thus, it is at the discretion of the hospice to develop internal policies and procedures for completing and archiving Z0500A. Electronic signatures are acceptable. Z0500B, the completion date, is submitted to CMS as part of the HIS record. Z0500B is intended to reflect the date on which the person has verified the HIS record is complete. When a hospice modifies an HIS record, the original Z0500B date should remain the same. Do not change the Z0500B date unless the date in Z0500B in the original record was incorrect, and the modification request is to correct the date in Z0500B. Using the original date prevents the modification, inactivation, and correction record from being identified as late. This concludes the portion of the presentation on updates to administrative items in version 1.02 of the HIS manual.
Thank you for viewing this MLN Connects video presentation, Module 3, on updates to Chapter 2, Administrative Sections of the HIS Manual, version 1.02. This MLN Connects video is part of the Medicare Learning Network. The information presented in this presentation was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.